Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Sa UK ka man or sa UAE, sa Amerika ka man, tandaan mo, you can use Taptap Send and our code PINOYUK for an equivalent of 25 AED pag nasa Dubai ka or UAE or 15 pounds extra on your first padala using Taptap Send. So, tap-tap ka na.
Always remember, Manong knows.
So what is the difference here is the US is so big and each state is very different. However, meron kaming centralized dito which is the federal. So sa federal ang level, it means all federal laws, all federal rules, all federal funding, it's distributed among the states. Pero each state will have their own income of money, and then they allocate it depends on what the priority of the state. Okay? For example, we call the Medicaid, CHIP, which is CHIP, that's a Children's Health Insurance Plan, that are all federal related benefits. And there is also our Social Security, which is also separate. So all the people who earns money here in the United States will have a paycheck, and on their paycheck, they will see their contribution to Medicare and Social Security. So we call it the FICA tax. Okay, so everyone, anybody who's earning income here in the United States, they will have to pay FICA. And it's a set rule. Nobody escapes that unless you are belonging to the low poverty. So this Medicare, or we call it Medicare Social Security, or what we call it the FICA, which is the payroll taxes, it really helps those funding of the healthcare. So ngayon, pag pinigay yan sa government, nagbayad ka, ako si Kaye, nagbayad ako ng FICA, nagbayad ako ng Medicare Social Security, it goes to the federal level money or income, right? So the government now will distribute that money everywhere in the whole state. But sino ang makikinabang dyan? Is it only the people who's working or is it the people who's also not working? Kahit yung mga bagong dating dito, they are covered by this insurance. Kung wala pa silang insurance, so the government is covering them. So is it coming from the federal or the state? The answer is both. Okay? So maraming tao dito nagsasabi, mahal sa United States, you have to buy your own health insurance. That is partly true. If you're a working individual and you are covered by your employer's insurance, the employer will have to pay a portion of that benefit. Okay, that's the way here in the United States. So, katulad ko, you have to ask before, who is my employer? No? So, if the answer is, my employer is the government, because I work for the government hospital, then you have to ask, the next question will be, are you working for the federal government, or are you working for the state government, or are you working for the city government? The answer for me was, I was working for the city government. And how is my health insurance look like? My health insurance cost me zero. I didn't have to pay anything. I don't pay anything. Even if I visit a doctor, I don't have to pay full pay. Even after I delivered, I don't have to pay anything. For my children's, nung na-ICU yung baby ko, after delivery, I paid zero. Because those are all government program, government benefits, or employee benefits. So I want to compare NHS similar to an employee working in a government facility because everything is covered by that. But the salary is a lot, right? Kasi parang sa UK, hindi kasing taas ang sahod ng mga ibang tao sa US, right? Because sa UK, magandang benefits. The same thing when you come to the United States and you land a government employer, it's similar to NHS, which is centralized. So it's just a matter of, is it centralized federal, is it central state, or is it centralized city? For us, we're the biggest employer of government hospitals in New York. So it's called New York City Health and Hospital Corporation. So that was where I used to work. A lot of people here in federal level work in VA hospital, which is veterans. So a lot of veterans, pag sinabi mo dito na, oh, I work for the VA, oh, we already know that you have very good benefits. You know, you pay zero on your health insurances, right? But there's also a thing called nonprofit organization. Okay? If it's a nonprofit organization here in the United States, it can be also nonprofit in a way that they do academic nonprofit. Like example is Johns Hopkins. We all know Johns Hopkins as a university, and it is called a nonprofit organization because there is like a tax benefit there on how things are working. So ngayon, kung may tax benefit ang hospital, most likely the employer might have extra funding for nurses benefits. That's why a lot of people who work in those big academic hospitals have very good benefits also. They pay zero or they pay very minimal. If you're going to be buying your own health benefits here in the United States, for a single person, it might reach them up to $400 per month. Okay, but if I'm working for a nonprofit organization and they will pay, I would say 90% of it, my monthly premium to pay that health insurance probably will be around $50 or less. Okay. So if I have family, my family could cost me also around 200 to 300 a month. Kasi pag binili ko yun sa labas, my family will cost me around 1,500 if I buy it. But if I'm with my employer, they pay a lot of portion of my health insurance, which is mga 70% will be paid by the employer, 80% will be paid by the employer, or even 100% can be paid by the employer. Depende. Kung maganda yung employer, they will pay that. Ngayon, what if I land those facilities that are, let's say, nursing home, okay? And for profit, hindi sila mga for profit organization, private owners. Yung mga nursing home dito sometimes are owned by private equity firms or management firms, which is totally not healthcare industry, right? So they call themselves management firms. So those facilities, they don't have the capability to give a very good health benefits because health benefits consumption is really done in the hospital. No? Pag na-hospital ka, right? So ang benefits ng nursing home is pag matanda ka, well, I guess then you get a free nursing home stay, right? But that's not really gonna help us much, right? Kung working individual ka on age of 40, 30, right? So nursing homes, unfortunately, don't have the same benefits as the people who works in the hospital. So most of the time, they end up having a little more expensive health benefits and poor coverage. Primarily because a nursing home, they don't own hospitals. So they don't have the leverage to give discounts for the nurses if they get hospitalized. Okay. So what majority of the nursing homes will do is they will call a vendor, like yung mga big vendor dito called, probably you've heard of it, Aitna, Humana, Blue Cross Blue Shield. Those are the big health insurance companies. And what the employers do is they will tell the nurses, hey, we got a good discount from this company, but you will have to pay like $400 a month. We're only covering 50%. Some are even covering like less than 50%. So the nurses who end up in nursing home most likely are paying a very expensive health insurance, not because na pangit yung nursing home, but just because the nursing home does not own hospital and they don't have the leverage to ask for discounted rates. So there's that factor there. Ngayon, kunwari, ako naman, nurse, this is another topic na. I'm a nurse, I'm a contractual nurse, but I subcontract myself. I created my own business and I subcontract myself, right? I will buy my health insurance to cover for myself. If not, I don't have an employer, so I will have to buy my own self. And then what happens to that is I will buy the full amount of it, like 1,600, right? But is it bad? Not necessarily, because usually contractual nurse like me or subcontractor, we charge the hospital or the employer more. Pag nakita mo yung mga nurses dito, they're earning $60 an hour. For me as a contractor, I can charge more than that. But then I will have to cover my own benefits. And the good thing about this here is since taxes is very complicated in the US, only few people know this. So what I do, even if I pay 1,600 a month, it reduces my taxation. So it's kind of like helping me reduce my taxes if I have my own business. So is it bad? Not really. I think it's good as long as I earn a lot. But for let's say, ang pinaka-winner talaga dito is no one. Depends on how you strategize it. For people in government, who are in the government, if they have dependents who have high usage of health insurance, then this is best for them. I know a lot of people who join the government employer, they're after for the benefits. Kasi walang binabayaran. Yung mga may dependent na, let's say, may asawa sila na high cholesterol or maraming sakit or may disability yung bata or may pamilya nila, any part of their family who needs a lot of health insurance, a lot of them go to government hospitals because the benefits it's good, very good. No? Wala silang binabayaran. Right? And then yung iba naman who works in the academic non-profit organization, hindi naman sila ganun kataasan ng sahod, no? But why do they go there? Because again, the health benefits is also good, and sometimes the employer who has an academic security will offer free tuition fees for all their kids. Especially kung Johns Hopkins yan, you're talking about $60,000 tuition fees. Right? Like kung ako kumikita ng $60,000 a year, $60,000 of tuition fee is a big amount of money. So I would go there. How about the people for nursing homes? The majority of people who enter the nursing homes, I would say marketing nila is entry level yan, no experience needed, right? So who are those people who have no experience? Majority of them are people who probably just graduated, right? And hindi naman sila sakitin right? So the health benefits really does not matter a lot. Hindi naman sila sakitin kasi bata sila. Or wala naman silang dependents, right? So that's fine. How about the salary? Well, the salary is not really competitive as others because, again, it's marketed as for the walang experience. But the trade-off for that is you can get here to the US right away. And if you want to do side job, double job, you can do it kasi bata ka pa. Right? And then for people like me who does business as a contractual nurse, it's good for me because number one, I'm a business-minded. Number two, I know how to negotiate. Number three, I'm very experienced. And number four, I belong to the, I would say, higher income level. So when you're higher income, then your taxation is highest, right? So there's a lot of high income earners here that would strategize ways to lower their taxes legally. So exactly din. So is there one best for everything? So the answer is not really. So there's no one is advantageous than the other. I think it's really what do you prioritize? What do you need the most? If you need the most is to come here to the US, right? So I think then you would go for those positions that are challenging to fill, like nursing homes, high turnover.
Manong knows best.
You have the option to also buy private if you want. Walang persahan. So ganun din sa academic hospital. They offer both the hospital benefits and as well as the private. So ang tawag namin dito is called PPO. So PPO is that insurance na hindi na private and you can use it anywhere, any part of the US. Kumari, usually ito maganda sa mga matatanda. Na kunyari may specific doctor sila na gustong puntahan. Kaya lang, today, nasa Maryland ako, pero next summer, I go to Florida kasi hindi ko tolerated ang lamig eh. So may tinatawag na gano'n. Like, a lot of people who lives in yung malalamig na area dito sa US, so they go to Florida or somewhere warm na states pag winter kasi hindi nila kaya. So then, the PTO would work best for them on those scenarios. So they can use different doctors from different states.
Manong knows best.
So, kung ano yung priority mo, but the important thing there is understanding your priorities first. Kasi kung hindi mo maintindihan yung priorities mo sa buhay, then you might be picking a job that might not be best for you. You know, or you're not maximizing the benefit that's available for you. But otherwise, clinically, I think UK and US have very similar setup. In my opinion, when I observed the people from ICN in Montreal, I asked them like, a couple of things. I think it's very universal. The clinicals are very universal. It's just the acculturation is different and the benefits.
Manong knows best.
Kaya maternity leave depende sa amount of money that you bank. So a lot of these hospitals and employers, they have to bank your they call it PPO or sick time. So they will say, oh, after 1 week you accumulate 1 hour of vacation. If you after 2 weeks of working, you accumulate 2 hours. So depends. So far the most that I have seen from mga bago dito is they're given like at least total of 4 weeks vacation. Sometimes 3 weeks yung annual leave mo, and then you get one week of sick leave, and then you can bank it.
Sa annual leave.
Meron naman dito, yung annual leave. So sometimes they mix it, they count it as PTO. However, kunwari maternity leave ka, and then kailangan may note ang doctor saying that you have to be out of work. If you don't have enough sick leave, then you don't have pay. Right? So katulad ko, I only had 2 months equivalent sick leave ko. So when I went on maternity leave for 4 months, only 2 months were paid. So yung 2 months ko, wala akong kita. As in, but because it was my preference to be out of work, wala namang medical necessity. But if I had medical necessity in my doctor's note, then it will be covered by the disability. Yung sinasabi ko kanina na Social Security. We also have disability through Social Security, so we can apply for it. We also have those FMLA, FMLA, which is Family Medical Leave Act. So it was a government program that allows US to take extended leave and with coverage pa rin. The iba coverage ng health insurance. So again, it's similar na may coverage. Pwede kang kumuha ng coverage sa government, but again, is it gonna cover everything? Hindi rin eh. So we're not being paid not even 70% for salary. So it's very minimal. So that's where in private insurance company will come in yung mga disability insurance. So private yan. So for me, kumuha ako ng nagtatawag na short term and long term kasi yung short term covered lang yan hanggang 6 months eh. And then after 6 months, you have to go through the disability ng government or your own long term. So may option ka, either go government or you go private. But like you said earlier, a lot of people will opt in for private kung may pera sila kasi ayaw nilang magantay.
Manong knows best.
Here in the United States, may tinatawag din ng mga union. And I don't know if you have union in UK. Do you guys have union?
Meron.
So they're the one who's negotiating the salaries, right? Or contract.
Yes, oo.
To have benefits. There are pros and cons of union. Hindi lahat dito sa US are union hospitals. Where I came from, it's a government hospital na may union. So it's good kasi they help us negotiate our salaries. Pero kunwari sa ibang places na walang union, medyo hindi marunong yung management or yung nurses how to come with an agreement of a good or good, good package, medyo doon yung tension papasok. But let's say California California is known as a strong union for nurses. So California has been fighting for a lot of like good working ration of nurses. And then they also are one of the highest when it comes to pay of the nurses here in the US. So kaya marami ka maririnig, California, California, go to California, the high paid. But also comes with the high tax rate for that and high cost of living. Yeah.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.